Human society is built on our ability to share and pass on information. It has allowed us to progress from the Stone Age to the Space Age. Today, in the age of digital communication and high-tech research, sharing data is more important than ever before. And this is especially true in healthcare. When the NHS was founded in 1948, things were quite different. Our medical records lived in dusty drawers, locked away in darkened corridors, and seen by very few, despite the need. Until surprisingly recently, even your GP and your local hospital would share very little data about your care. Data sat alone and unloved, its life-saving potential untapped. Today, patient data is an essential part of healthcare and underpins the services provided by the NHS. By understanding how we receive and experience care, the NHS can find new ways to improve. By linking patients' data from different parts of the NHS and analysing it, it becomes possible to diagnose health conditions earlier and provide new drugs and treatments for everything from asthma and heart attacks to diabetes, cancer and dementia. Data helps monitor the safety of drugs and vaccinations and makes sure that health services are maintaining a high standard of care. Data also helps the NHS plan for the future, from understanding which services will be most needed to anticipating changes in our society and our health. And just as important as the data itself is keeping it safe. Data held anywhere in the health and care system must be stored securely with controlled access. There are strict rules about how data can and cannot be used. Data is provided in the most anonymised way possible, with robust legal contracts. These safeguards are in place to protect privacy and ensure data is shared responsibly. From improving patient care to speeding up diagnosis and researching brand new treatments, data saves lives. It could one day save yours or the life of someone you love. To find out more about how patient data is used and your choices, visit patientdata.org.uk.
Hi everybody. I thought we were going again there. I'm Emily. I've got a heavily scientific background in academic research and then about 15-20 years in the pharmaceutical industry. I'm pretty obsessed with data and I also have stage 4 cancer. In the last few years, I've done more and more volunteering because once you start, it just kind of spirals. And I've been involved in a lot of different data-focused projects, like the animation that you've just seen. And this one was spearheaded by the Understanding Patient Data group, of which Nicola Perrin is the leader. Understanding patient data to me always sounds like an enormous remit. So the first thing I wanted to ask Nicola is just to share with you what UPD is and why it was formed.
Thank you very much. So you've just seen the animation setting out some of the benefits of using data and why we need to make better use of data to understand more about disease or to monitor the safety of drugs. But at the moment, there's a very, very low awareness among most people about how data is used in the NHS and why it's important. Focus groups suggest that less than a third of people have an idea of the data. And that makes them suspicious, wary, concerned. They have lots and lots of questions and concerns. And yet all the evidence suggests that the more information people have, generally the more comfortable they are with data being used and the more reassured they are. So we need to get to that place where people feel comfortable with their data being used. And we think to do that, you need to support better conversations about how health information is used. And that's why Understanding Patient Data was set up. We want to help provide objective information like the animations you've just seen so that people can make informed decisions where they have choices.
And what kind of other projects are you currently involved in and how they benefit patients?
So the two things that we're really trying to do is explain why it's important to use data. So the animations is one. We've got a bank of case studies as well on our website at the moment. And then also the how. So we talk about the safeguards, what the risks, why do companies access data, and a number of FAQs to really answer the questions that people have. But we're also wanting to develop advocates, so people who can really champion more responsible use of data. And that's where I think we really find that the patient voice works best. Patients can make the case more powerfully than anybody else about why it's so important to use data. And that's why I'm really pleased to have the opportunity to talk to you here today. So can you give us an insight from your experience as a patient?
Of course. And I guess I'm going to start, as Michael said this morning, I'm a sample size of one, and this is just one story among many. So for me, everything in sort of mid-2014, I was living a very busy but enjoyable life. My family were quite young at the time. I had an incredibly busy job, which I was balancing with training for a marathon and gazillions of other things, and just basically enjoying my life. Probably didn't realise how much. And then one day I just suddenly woke up and I felt a bit of a pain in my tummy, and I kind of, things spiralled from there. I went straight to my GP after a couple of days of thinking, oh God, yeah, it's just a bit of a bad tummy. And then I went to my local hospital and then spent the next month kind of pinging around different departments and suffering various misdiagnoses and some pretty difficult times, getting to the stage where I was just like, oh, I just want to know what's wrong with me. And then I found out what's wrong with me, and then I didn't want to know at all, because it turned out I have a condition called leiomyosarcoma, which is a rare form of cancer. At that stage, I had a tumour about 8 centimetres just near my kidney, and the immediate solution was I needed to have surgery. So at that point, I was referred on to a specialist cancer centre. I was in surgery within about 4 or 5 days, in fact, the same day that my daughter started primary school. And when I went in, they told me at the time that I was probably unlikely to make it to Christmas. But actually, the way the tumour had formed, it was all quite miraculous. And the surgeon was literally dancing at the end of my bed after the surgery and said, well, you know, you're going to be okay. So fast forward for a few months of intense recovery. My scans were clear, and the surgeon said, I don't think you're going to ever have any issues again, which was great. So life carried on, and I went back to work, albeit with a little bit of a better attitude. And then in July, I was at one of my regular scans, and the surgeon said, there's a couple of spots on your liver, but really nothing to worry about. We're going to do an extra scan just to check, and then that extra scan became a different type of scan, and then another scan. And then the upshot was that in September, I was told that the cancer was back, that it had metastasized to my liver and had 2 tumours. Stopped work straight away because we're going to need to operate again. I had the next liver surgery, which was on my liver in November of 2016. And they went in to remove 2 tumours, and actually there was another one, so I lost, I think, about 70% of my liver there. Thank God they regenerate, hey? And they took my gallbladder and various other bits that I still had left. And then, honestly, after that, I'd got myself into quite good physical shape before then, and if you'd asked me the day I went, you have to wait a few months before you can have a scan after you've had surgery. So when I went into that scan, I'd have said, okay, I'm going to be going back to work in a few weeks. I was back running, I felt fine, and I was not at all prepared for the news, but, you know, this is a brutal and hideous disease, and it turns out I'm riddled with this stuff. So the disease has now spread to my bones, so it's in my spine and in my arms, and another one back in my liver, what's left of it. And at that stage, you know, they can't just keep giving you surgery when you're at that stage of having metastatic cancer. They can't keep chopping and chopping until you're just a pair of eyeballs on a pillow. So my next option was chemotherapy. And chemotherapy doesn't work in sarcoma, sorry. But I'd done a lot of research because I'm a data head and found a clinical trial that was underway at the Marsden. Long story short, it took quite a while to get there, but I ended up on a unlicensed therapy plus established chemotherapy last summer. And I'm pleased to say I'm still here, because my prognosis was that I shouldn't be, and I'm still on ongoing treatment. The trial went pretty well, and then my ongoing treatment, I'm still on the trial therapy, which I think has now been licensed. And so far, I'm stable, I think is the word. I'm very stable.
Thank you, Emily, and thank you for sharing it. I've now heard Emily's story a few times, and it doesn't get any easier hearing it, but you talk about it so openly and powerfully, so thank you very much from everyone here. Can I turn back the data bit of it? How does data fit in your story? Was data sharing effective for your care?
No. And I guess that's why I'm here, right? If I go back to my little timeline, there were a couple of areas, in fact, there were quite a lot of areas across here, and I could probably talk for a couple of hours about how data sharing could have been better in my case, but I won't because we don't have the time. But I would like to just focus on a couple of bits. So this point in August, where I went from, I've got pain in the stomach, to being unable to walk up the steps in the hospital because I was in so much pain and couldn't drive and all of this. During this time, I think it was 5 different hospital departments I was seen by, and I was seen by my GP, obviously, and nobody talked to each other, and nobody shared my history, and nobody shared my notes, and that is so frustrating. Frustrating for me, frustrating for the people who love me, frustrating for the healthcare professionals who are trying to give me the best form of care. And nobody is joining up the dots. I'm not saying anything could have changed my diagnosis. I don't think anything really probably could have sped it up, but it could have certainly been a lot more of a comfortable situation than it was. You can always tell the long-term patients in the hospital because they're walking around with a big file of their own notes, and I think that's shameful. So that was very tricky. And then this area here, see, I always go through this really quickly, but at this time, I'm now at a specialist cancer institution in the UK, and I've been offered amazing care in the past. But yet it takes from July until November for somebody with a very, very aggressive form of cancer to get the treatment that they need. And again, I don't know, I can't look into the past and say things could have been different. But if that surgery had happened at the end of July rather than in November, perhaps that third tumour wouldn't have appeared on my liver. Perhaps the disease wouldn't have spread to my bones. I'll never be able to answer that, but I will be able to try and change things for other people like me. And again, sort of moving from one specialist cancer institution to another could have been made a lot easier. I ended up taking my own notes to the Marsden, taking my own copies of the scans because it was taking so long for things to get through. And in this day and age with the technology we have, I think that's unacceptable.
You talk about making things easier for other people like you. So what about data sharing more generally? From your perspective, how important is it that people share their data?
It's massively important. I think the cancer I have is very rare, and as someone with a rare disease, probably if you look in my local town of 10,000 people, there's only one of me. If you look across the county, probably there's one, probably on average 1.5. And if we don't share data in that situation, we're never going to learn anything. You're not going to learn anything just from talking to me. And this means patients and non-patients, and I think that's the vital thing. Everybody that's here today, from a patient perspective, understands this. It's everybody out there, the general public, the people who are just going to their GP for their contraception or whatever, they're just as important as well. And I do understand the concerns when somebody talks about data sharing. Everyone goes, no, it's mine, I want to keep hold of it. But where would we be without it? I like to turn that question on its head and say, you know, if we don't share data, what are the implications? A lot of the advances that we've seen recently or over the last 10, 20 years in breast cancer and HRT and heart disease, they've all been from data sharing. And I think this only comes about by things like today, by groups working in collaboration, the pharma industry, the NHS, your group, and I think things like today will bring about that change. But I guess the fact is, and the sad fact is, that my story really isn't unique. And I'd like to think about how we can better harness data to improve the experience of patients like me.
So I think the most important thing that we need to do is build trust and build public confidence. If we don't have public confidence, we're never going to be able to make better use of data. And yet the only exposure that a lot of people have about data is bad news stories in the press, whether it's Google DeepMind or Public Health England and tobacco companies, or, I mean, you only need to look this week at all the stories about Facebook and Cambridge Analytica, which isn't health data, I'm very pleased to say, but it all adds to this atmosphere of concern about data in general. So I think we need to look to the NHS to give much better reassurance to everybody about how their data is protected. I think there are a couple of things coming up over the next few months which should really help. There's new data protection legislation. I'm sure many of you in this room will have had far too many conversations about GDPR and be groaning as soon as I mention it, but it is an important step into providing new information to people, a real focus on transparency and fair processing, and that there are steps being taken to protect data. There'll also be a new national opt-out from the same time at the end of May across NHS data, and so we should all be hearing much more about that over the next couple of months, and I think that's important steps to start rebuilding trust.
I guess one of the most important things for me as a patient is that knowing that my data aren't just being kind of broadcasted willy-nilly, and I'm a patient who kind of gets how important data are. I spend probably on average about 8 hours a week in the waiting room at the Marsden, and I can see this concern reflected among all the faces and all the people that I talk to and I see on a very regular basis. And I imagine this will be even more magnified amongst the general public. From the UPD perspective, how's this being addressed to instill public confidence?
So I think it's really important that we're honest about the concerns and the risks, that we sort of start with the questions and the concerns that people have and tackle them head on instead of pretending that they're not happening. I think we can never say that sharing patient data is ever going to be totally risk-free. It won't be 100% risk-free. There is always the chance of a cyber attack. But a lot is being done to reduce the risks, and there are lots of controls in place, and we need to be much better at talking about those. So, for example, companies accessing data, which we know people are really concerned about. Every survey comes up with concerns about marketing, concerns about insurance companies. There are really clear restrictions on how companies could use data for marketing, or insurance companies can only access data, personally identifiable data, with your consent. We need to be able to talk about those controls because companies have a really important part to play, and particularly partnerships with NHS and charities. Companies are a key part of delivering research and care across the NHS, and so we need to be able to talk about that openly and honestly and be clear that there needs to be a health benefit if companies are accessing patient data. So I think it all comes back to that idea about being much better at having conversations. But one of the things that you just said there was the difference between how patients think and how the public think. And I think that there is definitely a distinction. I think patients are much more likely to get it. For the public, they don't need to worry about it, whereas for patients, they really get the importance of making better use of data, and we couldn't have had a better example from your story and the way you talk about it. So I think we need to make the most of harnessing that voice. Patients have such an important message about why they want their data to be used, and they want their data to be used responsibly, and so it's really a call for all patients to feel much more comfortable talking about this, to really champion responsible use of data.
Thanks, Nicola.
Thank you.
I guess.